Okay, today's taping session is on the patella. We're going to go through 4 different tapings for the patella, depending on the condition or the injury. And I'm going to go through each one, explain in detail what we're doing, how to do the technique, and what it's for. So, first one is for Patello-femoral pain. Now, we use this one kinesio tape. The other 3, we're going to use rigid tape. Of this one, it's kinesio tape. For this, you've got to, one thing you do have to do is measure the actual distance of the patella. Okay, so some people have big patellas, small patellas. That size of patella is going to determine how much tape you're going to use. So, okay, if we look at this size patella here, it's roughly about this much. So what we're going to do is have 3 of those. So I know it's a little bit exact, but you can be semi-rough with this as long as you've got 3 times the size. Then, of course, with all kinesio tape, just round those edges off. All right. Now, with this one, what you do is you're trying to get this patella glided medially, okay, as you do it. So, for the anchor point, you always make sure this anchor point is there's no tension. So 0 degrees tension with this one. So when I put this down, I want to be on the lateral side of the patella and above the patella. So I'm going to be up here. I'm going to cover over the edge. So you just look at where that edge is and you go, okay, I'm going to be right up on that edge there. And you think where that bit is, there's the top of the patella. I'm going to go just a little bit above it and anchor that down. Okay, so like I said, 0% anchorage for that first part. Then what you're going to do is come down and save the bottom third. Okay, so you can imagine this part is going to get stretched in the middle. What you do is you put your thumb on this side. So I'm going to come over the edge of that kneecap. I'm going to stretch it like that. And now I'm talking about sort of 75% stretch. As I come over here, I'm going to push that and glide that patella medially. And then keep the tension on and go over on an angle like that. Okay, so I'm coming around the side and the bottom of the kneecap. Then I'm going to lock down and have my 0% anchor again. So what it's done is it's pulled that kneecap, glided it over that way. Okay, so that's your first one. The second one is a little bit different, and that one is going to come directly immediately over. Now, you can sort of guesstimate how much you need with this. Just don't go too far, otherwise you're going to be wrapping it underneath the knee, because this tape does stretch, so it expands in length around those corners again. This one you start laterally, and again you have that same drill, 0% anchor. So if you look at this one, I'm going to go from the lateral side, so from the knee right in the middle there. Going to come the lateral side of the knee, okay, anchor down there. And this one, I'm going to come behind it, okay, feel where that edge of the kneecap is again, push it over. And the other thing about this is, what I can do now is once I've glided immediately, I can then pull down and do a little bit of a tilt down as well, and then anchor it down like that. So what I've done there is I've pulled it immediately and then I've anchored it down, or glided it and tilted it down that way, and that gives a really nice, secure sort of medial glide with that. Now that's for people with patellofemoral symptoms based on the fact that they've got maybe a little bit of a shift in that patella laterally, or they've got some wear on the lateral facet. Maybe they've got really tight structures on the lateral side here. Maybe they've got a really weak VMO on this side. Regardless, what this will do is offload that lateral side, okay? And that will give them a bit of a relief, and you'll find that people can walk around, it's a bit of relieving. Now with this one, like the other ones I'll show you, is make sure when you put it on, so it doesn't flip off, grab all the anchors with your hands, and then just hold them down and bend the knee like that, and then come down again. You might do that a couple of times. Bend the knee, come down again, and then you'll find that when she bends the knee herself, it doesn't come off, okay? So that's a really good little tip. So that's your first one. Right, number 2 is for patella instability. So this is where you're getting hypermobility, or you've had injury to the structures on the side of the kneecap, and maybe you've had dislocations of the patella. This is really helpful. And I'll show you what we do. It's quite an intensive taping, and when we have people who are playing sport, we then overwrap, and I'll show you that as well. So what you'll need is some underwrap, like Therafix. We're using 100 ml with this to cover the whole kneecap. It's really handy. Again, you sort of measure how much you're going to do with this. Make sure, this is quite a crucial one, that you use this to cover and underneath all the taping that you're going to do with this rigid tape. Now, this is obviously hypoallergenic, but we're using it for anchors, okay? So regardless of it being kinder on the skin than this is to stop your rigid tape slipping on the skin and falling off, okay? So having this down acts as an anchor, and that's, you know, one of the most helpful things you can do for this type of taping, because otherwise the tendency is the brown tape's going to come off. So this tape here, what you want to aim for is directly over that patella, okay? So you see where the middle of the patella is, and you're coming right over that patella. Maybe with a little bit of bias underneath the patella, to be fair. And then making sure you're covering it right down, trying to make sure there's no wrinkles here. You might want to be a little bit lower on this side, because that's where your tape is coming over there. So if you over budge on the tape, at least that's low down that side, but you're definitely not going all the way around. So there's your anchor that you're going to put this tape on top of. So what you're going to do for the first one is, we're going to do quite a lot of these tapes. You're going to go where that patella is, you're going to come a little bit underneath it, but I'd start directly on the side. Again, just push down the outer side here. Then you're going to budget how much tape you're going to use. And then when you come across, you're going to put a medial glide on this patella. Remember, 99 times 100, patella instability is not going to go medially, it's going to go laterally. So we want to stop it going laterally, which means we push medially. So this way, what you're going to do is come behind that patella, push it over, come over like that with quite a bit of crank, and come under it on a bit of an angle, and then come down. Remember, this is one of many. You can see how I've got enough there. Okay, so I went quite low on the white. That means I've got enough there. Now, it's okay to get little crinkles, and in fact, little pucking bits like that are quite good. It means you've cranked it over. So there's your first one. Then the second one, what I would do is come directly over that. All right, so your second one's sort of like reinforcing it right through the middle. I'd come maybe a little bit higher on the anchor point, so you're overlaying this anchor point by a little bit. And then you're going to go straight over with this one. So again, grab it, come behind that patella, keep the glide over, pull it over and down with a tilt. Down it goes. Okay, and then you almost like basket weave it. This is like, what bits have you missed? Okay, so again, you can come above or below, because you're just trying to increase the actual surface area of this taping. As this is only 38 mil. You can use 50 mil, which is a good bit more. Come over a little bit more, come across, come down. Remember, the whole idea of this is to glide and tilt. All right, and then we'll do one more over here. We'll go a bit higher, like that. And now what I've got, and I can feel that kneecap just not really hardly even moving. I hardly need to pull it now because it's moved right over. So I maybe focus on, if I haven't got enough tilt, I can focus on the tilt, and there you have it. Okay, so what that's done is it's basically given that person stability that they didn't have before via the taping to keep it in place. Again, these tapings tend to come off if you don't push them down. So again, you'd hold that, bend the knee up, push down as it comes up, do it again, make sure it's all sticking in place, go right on the edges, come up again, push it down, and so when they bend, it's not going to come off, okay? Now, for the sports people, what we tend to do is put on an EAB, so I'll show you that in standing. So if you're playing sport, we tend to cover this over. You can, if you're just not playing sport, cover over with some more white, fix them all over here, which will keep all that in place. if you're playing sport, we really need some stuff to add on, which is the EAB. Now this is a crepe one. You can use a 75 or a 50. We're going to use some 50 today. So start above it, come around. Like I said, it's going to sort of self-stick. You don't have to be too compressive with this stuff as long as you're covering all of it, because the main compression and stabilization is happening from the tape that is already on there. You're just making sure it doesn't come off, but the added little compression is quite handy. So that's coming on. Keep this anchored down, sometimes that'll come off during sport, so you add a little bit of this stuff on to keep that in place, and voila, there you have it, patella stabilization. Righto, number 3, this is for patella tendonitis or tendinopathy, trying to change the mechanics of that patella tendon. You'll have to go down to maybe a 50 mil with this tape, okay, to act as your anchor. So again, measure enough that you're going to cover where the rigid tape is going. And for this one, same drill, this tape needs to be nice and flat, but you're aiming for covering patella tendon. So go below the patella, the edge of the patella there, and obviously above the tuberosity. You probably find most people that distance is pretty much the same as this tape, and you're just aiming for keeping that in the same position as where you're going to use the tape. Okay, now first one, what you're going to aim for is trying to get enough downward pressure with this. So you measure a little bit of that either side. Okay, you're going to go, like I said, just below that patella, right on the tendon, right in the middle there for the first one, and you're just going to anchor that straight down with a little bit of a lift, not too much. Okay, so lots of pressure down and push it down. Now there's a little trick you can do with this, which is quite nice. What you can do with the next bit is act like one of those patella tendon braces. So you can put this anchor point here, okay, and then what you do is you then twist this and act like a little bit of a brace across the front of that patella tendon right in the middle. Now this is quite comfy for people, so you get enough over there, and then from here rip that off so you've got some anchorage. You're going to overlay this, so that's going to be okay. So from there you then and pull it across like that. Okay, so from that point anchor across, stick that down. Okay, so you've got a pressure down right in the middle of that patella tendon, which is like I said, acting like a brace, and then you overlay that again to keep that in place. So for this one, same as the first. Come right in the middle. You might go a little bit below, down near the tuberosity if you've gone a bit high, as long as you're covering that middle part. Grab it in there, cover all your existing anchors like that. Now what I might do for these people, just so things don't come off, again you're going to hold it and move them, okay, push it down as they go, do that a couple of times. Good thing with this, if they're going to have this on for a period of time, because hey, they might be walking or it's over the weekend, that sort of thing, you then overlay this. This just keeps it all in place, stops it coming off. So like the anchor underneath, it's almost like an anchor over top. But the biggest thing is you're covering the edges. Okay, that's the main thing. All right, so that's for your patella tendon, whether it be a tendinopathy or tendonitis. Fantastic taping for that. All right, last one, number 4. This is for your Hoffa Fat Pad Impingement. What it's designed to do is take the pressure off the fat pad. So we're going to do a little bit of elevation, a little bit of a tilt. So use your fixed model again. Like before, this is more about anchor than it is about skin irritation, okay? When you're measuring the first bit, what I would aim for is just go a little bit below patella, okay? You don't have to go too low with this, okay? So maybe this far below, and you're not going to want to go too high there because you don't want to start going into the quad here and restricting the actual movement that you're doing. So if you measure that, you're not really see this 1, 2, 3, 4 squares, that's about right. All right, so for her, obviously with taller people, there you'd go a bit further. You just got to remember you're not going too high with this. So with this one, you're going to start off, find out where that tibial tuberosity is. So as long as you're below that fat pad, all right, and then you're going up on an angle, but you've got to make sure you're just going on the edge of that patella as well. You're catching a little bit of that patella as you go. You don't want to cover over it, just on the edge. You just don't want to miss it. So from the middle there, okay, and then you're going to come over gently. With this one, you don't have to put too much pressure. You can just do a little bit of a lift, and then down you go. Okay, so I've caught a little bit of that patella on the way up. And then same drill, other side. Doesn't really matter if this stuff goes too high on people, because it's more about the tape that's going over top. So same drill, but you're doing on the other side. So it's like a V you're doing. Again, cross that over. Get your angle right as far as where's that patella edge of the patella. Make sure you cover it a little bit, coming up on that V angle. So okay. Then you want to put one over the top here. Now the one over top is right on the edge of the top of the patella, and the reason for this I'll show you in a minute, and that's to help with the sort of tilt towards the head. So this one, feel where that top of the patella is, and you're just going over like that. Now you're ready to put all your rigid taping down. So doesn't really matter which way you start. I like starting on the opposite side first. So measure where that is. You might go a little bit less than that. So what you do is make sure you don't get wrinkles like that. But you're going to try and put some upward tension. So you're taking the kneecap away from the fat pad. All right, so you're pulling up on that angle. Not too much, you'll make sure that stays down and down like that. Okay, so you're bringing it up, and that's happening on both sides. Now you could just do one if you feel like you haven't done enough, or you've gone a little bit too wide. You may have missed the patella. You can either redo it, or you can just overlay it. So this one, same drill. Make sure it's on the edge of the patella there, coming up. A little bit of lift. Doesn't have to be too much. Okay, you don't have to crank this one too much up. So if you feel like that, you may need to add some wide tape on here if you want to go a bit higher. But what that's doing is it's acting like a V and just pulling that kneecap away from the fat pad, which takes off the pressure. Now the other nifty thing about this taping is you do an anchor down, and that is specifically for this kneecap to tilt it that way. Okay, what that does, if you imagine the fat pad's underneath this patella, if the fat pad's here, when I tilt it, it takes the pressure off the fat pad. So this is a really nice one to add on the top. Just we see where that patella is, and just grab it, and you can see like when I grab that there, I'm just tilting it down at the top there. Okay, so it's just going that way. So when she moves that kneecap up and down, the whole thing is mechanically changed a bit, and it's super comfy. So same drills, bend the knee, make sure it all stays down. Do that a few times, get it all pushed down. Okay, and if there's little bits that are coming up, trick with that is, you don't need to redo it. So if you spot this sort of thing happening here, going, hey, I need to anchor that down, what you aim for is putting that down, and it's not going to go anywhere. So there's your fourth one. See how you go with those tapings, and we'll see you next time.